How do HIV and diabetes affect XDR-TB? Imagine facing a tough battle against a disease that refuses to respond to most medicines. Now picture fighting it while your immune system is weakened or your body is already battling another illness. That's what happens with extensively drug-resistant tuberculosis, or XDR-TB, when HIV or diabetes are part of the picture. HIV has a profound impact on tuberculosis because it damages the immune system, making it harder for the body to fight off infections. When someone has both HIV and XDR-TB, the disease tends to progress faster, and the chances of survival decrease. Studies from areas with high HIV rates show that patients with XDR-TB who are not on antiretroviral therapy have a much higher risk of dying. For example, about 2/3 of these patients may not survive a year, compared to only a quarter of those receiving proper HIV treatment. When HIV-positive patients have very low CD4 counts, especially below 50 cells per microliter, their risk of death increases even more. But the good news is that starting antiretroviral therapy, which helps control HIV, can significantly improve survival chances. Even with limited options for treating XDR-TB, combining it with HIV treatment is essential for better outcomes. Now let's talk about diabetes. This condition can also influence the course of drug-resistant tuberculosis. People with diabetes are about twice as likely to develop multi-drug-resistant TB, and by extension, they might be more vulnerable to XDR-TB. Diabetes can weaken the immune system, making it harder for the body to fight off TB bacteria and respond well to treatment. Managing TB in diabetic patients can be more complicated because of potential drug interactions and side effects, which can make sticking to treatment plans tougher. Some research suggests that when diabetes is combined with low body weight, the risk of death from drug-resistant TB increases. However, the exact effect of diabetes on XDR-TB outcomes is still being studied, and it seems to depend on other health factors as well. Interestingly, in patients who have both HIV and diabetes, the impact of diabetes on treatment results is less clear, showing how complex these interactions are. In summary, having HIV makes XDR-TB much more severe and deadly, but starting HIV treatment can really help improve survival. Diabetes may increase the risk of developing drug-resistant TB and make treatment more difficult, but its exact role in XDR-TB outcomes is still being understood. Managing these cases requires careful coordination of treatments, close monitoring for drug interactions, and addressing all health issues involved. Always remember, if you or someone you know is dealing with these conditions, consulting healthcare professionals is the best way to get personalized and effective care.